The disease concept was challenged very quickly, and I suppose one of the things that struck me when I first looked at this was just how brief a shelf life the disease concept had in Ireland. Almost from its inception, there were internal ideological struggles within INCA, mainly between the public psychiatric sector and the private sector, debates about the validity of the disease concept. And public sector psychiatrists, who catered for most people in this country, they were unhappy that they suggested that the disease concept just added to the confusion concerning personal responsibility of drinkers for their problems. I came across specific examples like issues of domestic violence, that if the stereotype, a man is an alcoholic, he's drunk a lot of the time and he's beating his wife. Some people suggested that the poor man had a disease. And this didn't go down well with the public sector, most of whom were inclined to say, well, whatever diseases you have, you must take responsibility for that behaviour, and probably there ought to be legal remedies for what is a criminal activity, whether that involves charging people with abusive or aggressive violent behaviour, or using family law to sort out those kind of issues. The public sector psychiatrists suggested that the therapeutic benefits of bringing people into hospital and subjecting them to, say, lengthy inpatient treatment were not clear. And as time went on, of course, it did become clear that lengthy hospital stays did not deliver outcomes that were any better than very brief interventions. The public sector from early on challenged the notion that population drinking habits were irrelevant, and they reverted to a sort of common sense view that if the population is drinking more, you're going to get more problems. And from the 60s onwards, we did a big changes in Irish drinking habits. In general terms, the public psychiatric sector taught the disease concept that it created very unrealistic expectations of what the public psychiatric sector could do, that you cannot treat away, cure away problems that are arising from alcohol consumption that was increasing all the time. Religious temperance went into decline in the 1960s. The Pioneer Total Abstinence Association, that had been very strong, that went into almost terminal decline from the 60s onwards. Another major change was that women, for the first time, became serious consumers of alcohol. Culturally, before that, women were not a big part of the market. Drinks companies manufactured products aimed specifically at women. And overall consumption was rising, and so the public psychiatric system and the two branches of psychiatry, all from the same professional background, fought quietly and in a very civilized way within INCA, but fighting it out. I refer to the demise of the disease concept. It didn't last that long. During the 1970s, the World Health Organization quietly dropped the concept and shifted towards a public health perspective, which is the one that has more or less persisted ever since. Here in Ireland in 1984, we had that second mental health policy document I referred to, the Psychiatric Services Planning for the Future. It didn't just say that alcoholism wasn't a disease. It said there's no such thing as alcoholism. It said it was a silly concept. For a public policy document, the attack on alcoholism in that document was pretty savage. The phrase I use there to say it disaggregated alcohol-related problems. It said it's silly to think that there's just one problem, you have alcoholism. It said alcohol creates, or at least contributes, to a whole range of problems. They talked about physical problems, physical illness, mental disorders, domestic violence, road traffic accidents, industrial absenteeism, familial dysfunction, child welfare issues. It spelled out, just disentangled a whole lot of those. And in many cases, they were making the point that people who were involved, who had a personal alcohol problem, were not necessarily alcohol dependent. They were not addicted, so that the focus on addiction was misplaced. The Psychiatric Services Planning for the Future suggested that we should move towards having brief community-based interventions, community services, rather than thinking always of hospitalization as the primary solution. And for the first time, a health policy document argued strongly for having an integrated national alcohol policy one that all sectors of government will be involved with, and they would look at total consumption, and they would look at all the possibilities for restricting alcohol, or at least stabilising it through all of those measures, control measures like pricing, restrictions in advertising, and restricting access at retail level. A year later, in 1985, the Voluntary Health Insurance Scheme introduced the first limits. They said they were not going to pay for more or less indefinite hospital admissions for alcoholism. I often, for my poor former students, will have heard me say this a million times. I worked in the public sector myself, but the psychiatrist used to tell a story about a guy that we dried out as an inpatient because he had very alcohol dependent, very complicated. Kept him for a couple of weeks and sent him off, having advised him strongly that he really shouldn't drink, and referred him to AA and for ongoing kind of support. And he stumbled back into the outpatient service about 3 weeks later, fell in the door very drunk, caught the doctor's eye. The doctor happened to be walking across the front hall, looked the doctor in the eye, and he said, "Doctor, my disease has broken out." The idea that every time your disease breaks out, you're going to be taken back for another month in hospital was something that VHI was beginning to jib with. And of course, in 1987, INCA was disbanded. In retrospect, it's clear that the disease concept, which does seem like a godsend to us, it offered a simple, popular solution to a very complex societal problem. It's equally clear that the policy process wasn't driven by science, it was driven by interest groups. But the most important thing is that the disease concept didn't provide a basis for effective management of drink-related problems in a society where cultural and economic changes were associated with increased alcohol consumption.